Hello everyone, welcome to the lecture on ICT and Health Sector. This lecture is a part of your paper on development communication. Earlier, we discussed the role of ICT in development process of various sectors and thus in nation's development. In this module, we will understand the role of ICT in healthcare sector. As we already know that ICTs are basically the tools that enable communication and information sharing by electronic means. But for this module, we need to understand the situations of health sector in a developing nation and how ICT can be properly intersected with the healthcare services. So in this module, we will see a snapshot of the types of ICT interventions that are being used in the health sector for improving the well-being of poor and marginalized people. And in simple words, healthcare sector can be defined as an interaction of several factors such as social, economic, biomedical, etc. and all these are interconnected. Now part 2 is ICT and health in a developing nation. First, let us look at a glance the prevalent health condition of developing country where there are some main health inequalities with limited access to timely and good quality medical support. Further, poor public health services, low family incomes, cultural gaps and location lead to the exclusion of huge number of households from the basic healthcare services. Thus, what we understand from here is inefficient delivery methods and lack of access to healthcare are common in rural and marginalized areas. This shortage in health sector is further exacerbates multiple crises in funding and unsuccessful reform efforts. So what is crucial here is to understand how ICT can be used effectively to combat these problems. ICT can improve the healthcare practices by providing reliable information as well as effective communication. The correct use of ICT tools can only increase the quality but also help people to prevent the onset of chronic issues. In this regard, social organizations that are working in improvised communities can play a major role. They can make people aware of the existing public health policies and its processing through ICTs. ICT can play key role in improving healthcare services, especially to the needy and poor. Now the question is how and in what ways can ICT be a part of strategies in order to improve the health of most vulnerable and marginalized section of the society. There have been worldwide discussions pertaining to the use of ICT in improving health, and there have been arguments that despite of all their potential, ICT tools have not been widely used to advance equitability. If cost-effective reform initiatives through ICTs can be implemented, then it can ensure greater access and higher quality of basic health care to every individual. There have been studies showing initiatives of setting up wireless internet connection in rural India, providing access to almost 85% of the rural people. ICT can be used to achieve better healthcare outcomes in a number of ways. It can be a really powerful tool in the healthcare delivery mechanism in a developing nation throughout the opportunities of remote counseling, diagnosis, and treatment of chronic issues. These practices are prevalent concerning many countries who are working together to combat the prevention of major epidemics. Like, for instance, field practitioners working in some remote towns of West Africa can collate the data collected on malaria or any other tropical disease to research specialists in United Kingdom, forming a larger network of ICT-enabled collaboration among nations. ICTs have the ability to improve the delivery mechanism of government healthcare services to the marginalized community, improve business partnership and unattainable markets within the reach of deprived people, facilitate the process of information sharing, enabling people self-sufficient to make better informed choices and health decisions with efficient and credible information, making the government aware about the possible health risks in rural areas. For accomplishing a certain amount of health-related objectives, health inequalities must be reduced, and ICTs are a powerful tool in achieving this. Effective results also require imparting health education regarding diseases and necessary treatments. Further, the convergence of technologies can also help improve the accessibility medical information for health workers as well as patients. For example, through using online broadcasting systems, radio stations can widen their range, then it can enable the content with health issues to be heard extensively. Thus, here is another point that proves that effect of ICT also appears to be successful when they are needed as enhancement to the already existing media. Now next part is part 3, implementing of ICT in health development. Mobile phone in recent times have become an indispensable part of people's life, and it is not surprising that it has reached to even the remotest of areas with significantly reduced cost of service providers. When people have access, they can seek information, advice, and treatment. According to WHO, information and communication technologies have always been a pillar of improving clinical services to diagnose, cure, and prevent diseases. Development of a framework of existing infrastructure and initiatives is crucial for understanding ICT in health programming in a developing world. This module demonstrates in details a number of initiatives of ICT that prove critical in improving health sector, beginning from the information sharing to delivery of healthcare services to the excluded populations. In recent years, there have been an advancement of initiatives like e-health and telemedicine. Countries like Brazil, Colombia, Chile have introduced telemedicine and e-health programs. For delivering of such services, wireless networks are mandatory, and it is one of the main factors posing challenge for the rural poor. ICT services can do wonders in the field of health or any sector, but it is not only the availability of the ICT services that can help. Business partnership and interest have to be developed for penetrating deeper in the rural areas. People have to be made aware about the current accessing of online health services and issues of sustainability for mobile network providers needed to be addressed, and assurance of higher traffic will increase their participation. In this context, one point needs to be mentioned that will help in distinguishing how the situation is developed countries differ from developing countries. Most of the experiments on the possibilities of ICT in delivery of healthcare sector and its context of developed country, which unfortunately have no direct applicability on developing nations. Say, for example, experiments concerning role of ICT in improving diagnosis with reduced cost in a developed nation may yield results that primarily healthcare could be provided by physicians who will be aided by ICT-driven support tools like diagnostic tools. Such experiments may possibly reduce cost in healthcare provision in a developed country, but it would have no immediate significance in developing countries where cost is secondary concern and inadequate service delivery being the primary concern of health sector. Now, we will be touching upon some specific components of ICT and their role in the health sector in details. We have previously mentioned telemedicine, which basically means storage and transmission of relevant health-related data. Here, ICT can help in the transmission of clinical images of diagnosis and records to far-off places within no time seeking further consultation. It is basically an extension of on-the-spot regional healthcare services and overcoming of shortages as such. For instance, in a remote village where some healthcare professionals and nurses are deployed in some rural areas, and if there are cases where they are unable to recognize any symptom, they can simply take a picture of the same and send it immediately to some expert physician who can prescribe a treatment or can send the image for further support to a specialist. We cannot deny that accessing to medical experts is problematic for inhabitants of rural areas. Not many of them can afford to travel to urban areas for better treatment opportunities, and money is also a major constraint. However, execution of telemedicine initiative is capable of opening up significant opportunities for specialized care for rural people. Another interesting observation made here is that this model of sharing images for examination by doctors in practicing in advanced laboratories can also facilitate association among specialists for different places. For example, captured image by medical trainees for a rural area in Bangladesh can be sent to experts in India for further consultation. Secondly, e-health is another term that we used earlier in this module. Now, what we understand from the term is that e-health refers to the use of ICT to empower healthcare services and activities such as surveillance and monitoring. ICT can be a very effective tool of coordinating healthcare delivery, especially in rural areas, which are generally marked by poor communication infrastructure and where diseases are widespread and in some cases unattended. It also helps in quick dissemination and delivery of updated medical findings to a larger number of people with much reduced cost through applications like email. Through ICT, government agencies can keep a tab on the outbreak of diseases that can further help in collating all data and implementation of mass immunization programs. Another significance of using the ICT in health promotion is through digital video. Some studies show that in some countries like Mexico, Ghana, South Africa, Cambodia, health workers carry DVD players or laptops and portable digital players in villages with the simple purpose of communicating a basic message followed by discussions. Technological advancements have reduced the cost of these devices, which earlier used to be quite expensive and less portable. Basic video production can easily be done on a basic computer, and health workers can also make it the preferred local language, and the entire process is cost effective. This particular way of knowledge sharing based on the videos can be quite effective in bringing a behavioral change. So, if we sum up the above discussion and materials, we learn that in every specific area of health sector, ICT is used. The benefits of ICT in health sector extend to areas such as health education, timely diagnosis and prevent of chronic diseases, monitoring and efficient treatment scopes, training to healthcare professionals, proper management of healthcare services. Along with the general population, it is also the healthcare authorities who benefit with the implementation of ICT in their works. Medical practitioners can have access to the latest research findings or can exchange data on some emerging health issues and can obtain ideas from experts all across the globe. ICT and its role in improvement of health in any developing nation can be explained in 3 stages. The first one is the role of ICT as an instrument for continuing education and learning processes that will facilitate awareness among the general public about cases and possible prevention of diseases. This lifelong learning process essentially also includes the medical practitioners in both urban and rural areas for remaining well informed, trained and updated the use of advances in the field of technology. This is particularly necessary as we are mentioning such positive roles of ICT in health improvement. Secondly, initiative from authorities for efficient delivery mechanism of vast range of healthcare services such as online consultation on coping up with emergency health situations and basic medications to the rural areas and the needy people must be made. The third and the last phase is the role of ICT in creating transparency scopes in government plans and policies so that very individual must be made aware about the health services which the government is planning and the people are entitled to. Now, we come to the fourth part, which is challenges and constraints of ICT in health sector. In this segment, we will be discussing the constraints with regard to the ICT use in health sector. Healthcare systems are complex and constantly expanding. Its nature is unlike other sectors of banking or education where limited terms are used. It involves technology that at the same time includes management, organization, financial and other collaborative initiatives for better functioning. Healthcare sector is indeed crucial, must be captured, crucial. So for ICT to be really effective, all information must be captured, stored with proper detailing with trained manpower. Some other major constraints in this sector are the access and cost. When we were specifying the experiments in developed countries, we had noticed that cost is the second major problem besides the proper delivery of basic health services in a developing nation. Hence, the transmission of functional clinical data and intricate medical images of the higher bandwidth is expensive. An initiative by the ministry must be taken for making an impact. The constraints of implementation of ICT in a developing country are far more severe, where even the access to telephones and broadband is either limited or not available across a widespread geographical domain, or even if access is there, it is way too expensive. So, selective investment in the health sector may pave a way for ultimately overcoming such shortages of digital divide. Digital divide is a major problem in developing countries, and a number of reasons can be cited for this problem. Firstly, a vast majority of the inhabitants is likely to remain left out for the benefit of information and communication technologies, considering the geographical location. Secondly, even if there is the accessibility, lack of training or education will lead to the non-acceptance of ICT. Lastly, the constrained advancement of the technology may lead to lower levels of competence or confidence in adapting to the changing environment, resulting in the inability to continue accessing the ICT benefit. Now let's conclude this module. The main conclusion that we can derive from this module is that ICTs, if incorporated effectively into health development initiatives, then it can be useful in achieving improved health services and conditions. We have learned both the possibilities and challenges of ICT and its role in improving health sector. We studied the role of specific components of ICT in health development, such as e-health and telemedicine. At the same time, we have noticed that there are possibilities that ICT opportunities that are theorized in the abstract may not be applicable in practices. For example, use of ICT in advancing health status in remotest of areas through telemedicine that offers delivery of clinical advices and appropriate treatments is still considered as nascent in a developing country. Though there are challenges and restraints considering the distribution and cost of medical treatment to people through ICT, yet there have been constant developments. Through ICT supported mechanism, health workers are capable of accessing to appropriate training, and it is essential for the larger beneficiaries. If the gaps in the availability and accessibility of the basic ICT infrastructure can be reduced, then it may bring more than proportionate welfares in the health sector of a developing country. So, the main lesson learned in this module is that the basic strategies like improved livelihood and quality education support the meaningful implication of ICTs in improving health. For more detail, read the module carefully and attempt the given question. Thank you.